But I want to welcome you tonight. My name is Peter House. I'm the director of the COPHP program here at the University of Washington. We have a great session for you tonight. Our students did some great projects and they're very eager to report to you. So I'm in the School of Public Health, University of Washington, and these are some projects that our students did in partnership with our friends from Seattle Neighborhood Greenways. And in a minute I'm going to introduce you to Kathy Tuttle, but let me say just a little bit more about what we're up to tonight. And first of all, if you need to get out of here in a hurry, and my environmental health folks tell me I always need to say this, go out this door, take a left, and then your first corner you get to, take a right then, and you'll be right over the Brook Trail and you'll be safe and out of the building. Unless it's smarter to get under the desk, but somebody else will adjudicate that. And also out in that area there where you saw the espresso stand, there's restrooms out there, you'll find them if you need that as well. So I just want to tell you a little bit about COPHP. This is a community-oriented public health practice program. And it's a program that uses strictly a problem-based learning pedagogy. So translated for regular folks, that means that we don't give lectures, we don't give reading assignments, rather we give the students problems that they work on. Some of the problems are very theoretical, they're stories that we kind of make up, usually based on the experience that the faculty had. But then some of our projects are with the community where we find community partners, and this is where Seattle Neighborhood Greenways comes in, that want some actual work done. And some of these cases maybe just take 2 weeks. This one the students had 5 weeks to work on. And I won't step on their lines and tell you what they did, but because they're going to do that soon enough. So this is part of a longer case that the students worked on. I think you're going to be very eager to hear what they said, or what they did on this. So Kathy, if you could just say a little bit about Seattle Neighborhood Greenways, because she's our partner in these cases. She's the one that had some work she wanted done.
So thanks, Peter. Seattle Neighborhood Greenways. So my name's Kathy Tuttle. I'm the executive director of Seattle Neighborhood Greenways. And Seattle Neighborhood Greenways identifies, advocates for, and activates safe, healthy streets all over Seattle. We have 21, possibly 22. I think there's a group starting up in Federal Way now. Community-based partnerships of safe, healthy street community organizations, all volunteer, and it's so great to work with this organization activating safe, healthy streets in 2 of our neighborhoods with a lot of economic and cultural diversity in them. I wanted to actually call out, we have a couple of our leaders from Seattle Neighborhood Greenways who've been partners in this program. Janine Blaylock, if you could just raise your hand. From Lake City Greenways, Deborah Barton from Rainier Valley Greenways. And actually, Jeff Lynn is from Green Lake Greenways, and Barbara's from East Lake Greenways, and I don't know if there are other kind of, I think that's our kind of Greenway leadership who's here tonight. But it's really terrific to have that kind of community partnership at the very local grassroots, really advocating for safe and healthy streets. And I really value the work that's gone in through this program. So thank you.
Thanks, Kathy. And so let me use the behavior U model and recognize some leadership in our school. We're honored to have Dr. Howie Frumpkin, who's the Dean of the School of Public Health here tonight. And Howie's, one of his primary interests is the built environment. So it's great to have him in the crowd. We really appreciate it.
Where is he?
He's right here. Okay, so just to poll, raise your hand if you're a COPHP student, a second-year student. Okay, as you look around, how about first-year COPHP students? How about other Greenways activists, people interested in it? Even if you've already been introduced, raise your hand, Greenways folks. Yeah, we really appreciate you coming. It's a wonderful opportunity for our students to be able to present to you folks. Are there other University of Washington students? Staff? Yeah, great. Okay, so we've got a nice crowd here. Anybody that I didn't mention? Yeah.
We have a city staffer from SDOT, Dong Ho Chang, just walked in. He's at the end there. Wave your hand.
thanks for coming. And again, if anyone has any trouble hearing, just tell us, we'll talk louder. Those cool little things on the desk in front of you, if you just touch the front of it and then speak, we'll be able to hear you at the Q&A part. So with that, let me introduce Jenny Shipkin, who's going to be your first Master of Ceremonies today.
Mistress. So as Peter said, my name is Jenny Shimkin. I'm a second-year student in COPHP, and I'm representing one half of our group tonight for this introductory period. This is not my project, Jenna will tell you more about that. But I wanted to tell you a little bit about the unique framework that we bring to this project as COPHP students. As Peter said, our curriculum is all problem-based learning, but our framework is all about health equity, social justice, and community action. So we start with our first cases in this program from the perspective of who's not at the table, or who's at the table. That's literally the name of one of our first cases. And we talk about different voices, how we can engage different corners of the community, and how we can sort of get our hands dirty with the work of public health. So we are coming from a pretty unique angle on all of this, and we tried to use equity and social justice frameworks in all of the work we did on these projects. So Jenna's going to talk a little bit about what is equity and why it's important.
Thank you. My name is Jenna Hudrin. I'm also a second-year student representing the other half of this particular project, which you'll hear more about shortly. So we wanted to address the title of this presentation, which I believe is Equity, Public Health, and Active Transportation, if I remember correctly. And so we wanted to kind of call out why we said equity and not equality, which I think is a really common question or concern that people might have. And so I wanted to give an example of why we use that particular wording. So I'm guessing a lot of folks here are bicyclists. So let's assume that's not such an ugly rainy night out, and a lot of people rode their bikes here. And let's say after the presentation, everyone who rode a bike went outside, and there was someone who was there giving bikes back. But they weren't giving you your particular bike. They were just giving you a bike that happened to be there. And you might say, oh, well, this one's too big for me. This one doesn't have my special broken-in Brook saddle that I've been working on for the last 10 years. And I feel like that's a really appropriate analogy, that that's a case where people have an equal access to a resource. Everyone has a bicycle, but it's not the appropriate bicycle for them. And so with these projects, we really tried to have a perspective of thinking what would be the right way to approach these communities. Using an equity framework is not unique in this county. King County has an equity and social justice framework that they use to inform all of their government work. And so we feel that that dovetails really nicely with what Greenways is doing. And in fact, Greenways already has an equity framework by working in such a decentralized manner with different community groups who go out in their own communities, look at the different conditions, and figure out what's right for them in terms of this overall project. So we just wanted to call that out, and I think Jenna can give an example about ways that Greenways can further promote equity in their work.
So we know that Greenways uses equity in their framework and in a lot of the work they do. And we tied this back to our own projects by thinking about community and cultural humility. We prefer humility to cultural competence. But the idea that we don't know everything, and most of us don't live in the communities where we were doing this work, so it's really important to remember that while we used a framework of equity and social justice in developing a lot of our ideas, it's really important to take them back to the communities before trying to implement them. Because just because we thought it up doesn't mean it's a great idea for the people it might actually affect. So that's just sort of an idea, a simple example of how Greenways, in using what we've come up with, can really make sure that they're working on an equity level. And speaking of community engagement, I'm going to hand it back to the Little Brook team, and you'll hear from us again in a little bit.
All right, so we're going to move in now to one of our actual presentations here. We're representing the Little Brook team here. Again, my name is Jenna. I'm here with my co-presenters, Patricia Atwater and Tiffany Sin, and we're going to describe the project that we did in Northeast Seattle. We're representing the group of 8 students who worked together on this project. So what you're seeing here is a little-known feature of Seattle's landscape, the Little Brook, and we'd like to introduce you to this tonight. About a month ago, we were introduced to this brook along with Little Brook Park, which surrounds it, and the entirety of the Little Brook neighborhood, when we were given the charge of involving local residents with Lake City Greenways. Lake City Greenways is a member of the Seattle Neighborhood Greenways Group, which Kathy gave a great introduction to. They're working to make residential streets more walkable, bikeable, and sociable through different infrastructure changes and street presentation. In their planning, the leaders of Lake City Greenways saw that the Little Brook area, which probably has the most need for enhanced pedestrian infrastructure, was least represented in their planning. So we as public health students who focus on community building were tasked with finding out three things. Who lives in Little Brook? How do residents connect with one another and the larger Lake City community? And what is their vision for an ideal neighborhood? We work with guidance from Lake City's Little Brook Squeaky Wheelers, a newly forming community group that's also working on safety improvements in the area, and you can also see them here giving us a tour through the neighborhood. So Little Brook was identified to us, go ahead, as the blocks here, bounded by Lake City Way to the east, 135th, to the south, 30th Avenue northeast to the west, and northeast 145th here, the border with Shoreline to the north. This area is located in the notorious no sidewalks land of North Seattle, where even basic pedestrian infrastructure is sorely lacking. The need here is definitely significant, as the majority of residents are low income, and almost 1 in 4 people living there are under the age of 18. So these youth really need good, safe areas to run and play and be able to get to school safely. The area also has a large proportion of people with disabilities. And interestingly, like Little Brook itself, the idea of Little Brook as a neighborhood is obscured, with few residents recognizing themselves as a unique community in terms of the larger Lake City community. So when we were given this task, we explored the ways that the places people live, work, and recreate, also known as the built environment, are public health issues. So the 5 main elements of the built environment are strongly associated with both individual and community health. Those 5 elements are housing, transportation, food, parks and green spaces, and disorder. We also investigated several community building frameworks put together by prominent organizers to guide our work. And now Tiffany will talk about how we actually did our project.
Thanks. So, our first exposure to the area was a neighborhood tour of Little Brook, guided by 4 long-term residents, as seen here. We went into the community to obtain input directly from residents. And we want to really highlight that although this community project was not a research study, however, we still used research methodology to inform our information gathering. We developed 2 tools. The first was a short questionnaire that was tested by community members, and secondly, we developed a mapping tool. So these tools were, the mapping tool was used to capture the perception of residents in areas that they felt were safe and unsafe, and also to identify common routes that they used to go from place to place. And, so next. From secondary data, we recognize that Little Brook was a very dense area. Over 90% of the population are renters, and a lot of them live in apartment structures. And because we wanted to reach to as many people as possible, we used 4 different approaches to reaching the community. So the first one was that we actually interviewed 21 community leaders, including 8 businesses. Secondly, we did door-to-door canvassing and knocked on every single street in Little Brook. Third, we also connected with apartment managers who were kind enough to let us into their apartment buildings and speak with residents. And fourth, we did convenience sampling at places such as Fred Meyer and Little Brook Park. So, in total, during the 1-month span of our community project, we went into the community for 64 student trips, and that reached a total of 141 residents. And I put a gold star there because I felt like we did a pretty good job in 1 month. And so for findings, who were these people that came into the community? So we found, out of the 141 residents that we interviewed, we found that over half were adults and a quarter were over the age of 50. Unfortunately, we didn't speak to as many children and youth as we wanted to. Secondly, we spoke to half of our interviewees were women, as well as 47% of the people were people of color, which we identified as people that were not white. We also spoke to, the majority of the people we spoke to were also renters, and we also found that people came, there were many immigrants in our community. So these people had either immigrated themselves or they're from countries all around the world. In the map, you can see the areas highlighted in yellow. Those are areas that are represented, countries that are represented, and the most common were countries hailing from Mexico as well as East African countries. And because people come from all around the world, oftentimes English is not their first language, but that didn't deter us. We actually spent the time to interview in multiple languages, including Chinese, Spanish, and an East African language, but he's not here today, but we did that. And from our connection with the community, we have a few recommendations for targeted outreach. So because there's such a diverse population, we really recommend that when reaching out to the community that you advertise in multiple languages and also post information in non-electronic sources. So you can actually use pre-existing leadership structures, such as apartment managers or a community bulletin board, to really share the information with the community. We also recognize that there are a lot of families and young children in the community, so we recommend actually hosting events that provide childcare for these families. So, in spending time with Little Brook, we began to understand who the people were in the community. And as you can see, many people had many, many things to say, as well as ideas on ways to improve the neighborhood. So we used qualitative analysis to derive three common themes. First, we found the theme of crime and pedestrian safety. Second, we found private and public investment. And third was social cohesion. So I'll go into crime and pedestrian safety first. So, like I mentioned before, we used a mapping tool. This is our fear and comfort map. And we asked residents to use different colored highlighters to indicate which streets they felt were the most safe and all the way to the least safe. So the ones in blue, followed by green, yellow, orange, and red, with red being the most unsafe, are indicated here. And the width of those lines are the streets that were mentioned the most frequently for being unsafe. As you can see, if you remember Jenna's map, the red area actually completely directly overlays the community of Little Brook. So that is the area that is perceived to be the most dangerous. So in terms of themes, we asked them their general interpretation of what it meant to be safe or unsafe. And this was divided into crime as well as pedestrian safety. So with crime, the common themes were illegal drug purchasing, as well as general illegal activities. People also mentioned nuisance behavior, such as drug dealing, public drunkenness, yelling, and people really shared stories with us about how they've heard gunshots in the neighborhood or have experienced a car burglary in other instances. Still others perceive that crime really has improved in the past few years, but the Seattle Police Department, their data still kind of paints an unclear picture. Nevertheless, the dominant perception is that crime is prevalent in this neighborhood and it's dangerous. And we suspect that this perception has led people to change their own behavior. So this includes people choosing not to walk around late at night because they feel like their personal safety is at jeopardy. And they also choose to bring their kids farther away outside of Little Brook so they can go to safer areas for play. So we have a few recommendations for Lake City Greenways. This includes supporting the newly formed Neighborhood Block Watch to put more eyes on the street. And secondly, we really encourage the neighborhood to create events where you can meet your police officers and have conversations at the home and in the community. Now, aside from crime, we also identified bicyclists, pedestrian, and traffic as a main concern for people. And one tool we used was the same map, but we asked people to put down their primary destinations as well as the common routes they used. We can see that the thickest parts are the routes that were most commonly cited, and Lake City Way is the most common route that people use. So people do travel. They travel by foot and equally, basically, by foot and by car. However, there were many complaints. So people mentioned, like before, that there really aren't any sidewalks in the area. And other infrastructure issues include unpaved sidewalks, not having city lights, disorderly parking, potholes, and so on. And there's also many steep hills and other issues. So without a defined space for pedestrians, Littlebrook's roads are especially dangerous for the most vulnerable, including the elderly, people with physical disabilities, as well as young children. However, despite these conditions, we notice that people are still walking and biking. And in addition to the terrible infrastructure, people are also very concerned about the driving behavior. So people mentioned that drivers were commonly seen as reckless or crazy, or even like driving like a bat out of hell. And we can see also that there's a mix of many vehicles in the area. In this picture, we have the school pets mingling on an unpaved sidewalk next to people in wheelchairs and young children. And what you also don't see are construction trucks and other big vehicles. So this really creates a very dangerous environment. So we have a few recommendations for Lake City Greenways, and that includes continuing their advocacy towards creating safe routes. This includes adding more structures to calm down the traffic and also to slow down the traffic. And so we also recommend to connect the greenways through Littlebrook Park. So right now there's a proposal for greenways on 27th as well as 35th, but we also recommend connecting the two through Littlebrook Park to create a safe route. And secondly, we recommend community events to really bring awareness to the community. So this can be done in a type of community building event with artwork. So inviting children over to create chalk art or to make their own signs to really highlight the traffic hazards that exist in the community. And now I'll bring it over to Patricia.
Thanks, Ted. I'm Patricia, and I'm going to talk about public and private investment in Littlebrook. So as we were hanging out in Littlebrook Park one day, waiting for people to walk by so we could pounce on them and ask them questions and annoy them generally, one woman came up to us and said, "It's about time someone started to pay attention to this neighborhood." And that's a sentiment that we really heard a lot. So people are feeling neglected by public and private entities. So on the left here is our mayor, Michael Finn. He's on a bike, but we don't think he would be smiling so broadly if he were riding his bike in Littlebrook. So first, the good about public investment. So we learned from our interviews that residents really appreciate the convenient and frequent bus service that serves Littlebrook. However, there's a lack of consistent attention from local city agencies that's visually reinforced as people make their way through the neighborhood. And neighborhood appearance isn't just a minor aesthetic issue. The broken window theory suggests that a building with one broken window that goes without repair will lead to all of the windows in that building being broken, and then the surrounding buildings. And then those broken windows in turn lead to additional neighborhood disorder, which can translate into crime rates, affecting social cohesion. Here's some more pictures of Littlebrook for you. So this is meant to symbolize sort of the business side of Littlebrook. So this is a Toyota parking lot. Toyota has a big dealership on Lake City Way that many of you have probably seen. So first, the good with business investment and private investment. So most residents cite Littlebrook's convenience to grocery stores, especially Fred Meyer and Grocery Outlet, which are both nearby, as a major benefit of living in the neighborhood. There are also a few small independent businesses that have a kind of a close relationship to the community, as far as we were able to tell. But by and large, businesses in Littlebrook have few ties to the neighborhood. Probably a lot of you have seen all of the car-related businesses that are up there. Those folks don't derive their customer base from Littlebrook. And so we suspect that that results in very limited investment and engagement with the community. So our recommendations are, we recommend getting Little Brook on the radar of local political leaders, like the city council members and the mayor. One option is to engage Little Brook residents in a postcard campaign. So here's an example of what a postcard can look like. So such a campaign could demand safer streets or whatever was deemed appropriate at the time. Another important way to get Little Brook on decision makers' radar is to convene the Olympic Hills Community Council. So right now there's not a community council representing the broader neighborhood that Little Brook resides in. And so we think it's really important to get Little Brook and its environs hooked up into the Department of Neighborhood City apparatus. As far as increasing private investment, community members already told us that they want to get in touch with neighborhood businesses. So they should start with those that provide goods and services to the residents of Little Brook and not those car dealerships that don't. These businesses are detailed in a report, and they could be asked to support resident-led trash pickups or to co-sponsor events, donate goods and services to community initiatives. So we have a lot of other recommendations that are to be found in our report. And Jenna is going to talk now about social cohesion.
Okay, so our third theme that we came across was social cohesion. And this refers to the sense of belonging in and to a community. The three key points that emerged in this area were the absence of common space, the mostly weak social networks, and social tensions and trust. So in terms of common space, the lack of sidewalks and public spaces in the area really prevents interactions and prevents people from knowing their neighbors. Despite this lack of public spaces, we did find several private spaces that were available in the neighborhood for community events, and those are detailed in our report. Social networks refer not just to how people are connected on Facebook, but how they interact in real life as well. So in terms of social connections in the neighborhood, they do seem mostly limited. Some people report having sort of a degree of friendliness with their immediate neighbors or people in their building, but in terms of knowing people in the larger neighborhood, they really don't seem to connect to each other. The exception to this may be particular language or cultural groups who we did hear about more often being more connected. Social networks can foster the spread of information, specifically around neighborhood happenings, but unfortunately, because the networks in this neighborhood are so weak, people don't really hear about what's happening in the neighborhood. Those who do reported that they heard things from immediate neighbors or from the newspapers, but mostly people said that they didn't really find out much about the neighborhood. And lastly, the final consequence of the weak social network is that there are few identified leaders in the neighborhood. So we did identify a few people who were staff members at local public housing communities, but in terms of informal leadership, we really didn't have many folks who came to the top beyond those who are already identified to us. I guess I'll make a little note that we did present this in the community on Thursday, however, and some people did volunteer to get more involved. So maybe this will be kind of the start of the ball. The last area that we heard about were social tensions and trust. And we did detect some underlying social tensions between differing community groups, specifically around race, class, and age. And residents thinking of these group members as the other and not like themselves can really further breed distrust. So our recommendations in this area relate to ways that we perceive Lake City Greenways and other neighborhood groups as building up and adding scaffolding to these weak social structures. One is to connect apartment managers who are already more connected to people in the community and expressed interest in being connected to each other to talk about common community concerns. We also suggest finding fun ways to connect residents. As Seattle organizer Jim Deere says, why have a meeting when you can have a party? And we really thought of a lot of different parties that could be held in Little Brook, including flea markets, block parties, events at the park, and community art projects. We recommend making the events inclusive of children and dogs because residents did mention these very frequently as a source of affinity. These events could also build leadership by if they tap local youth to actually do the organizing and working. It seems like there's a lot of capacity there. So now I'll turn it over to Patricia for some concluding thoughts.
So we've talked to you about our findings in these 3 areas, but really they're not so mutually exclusive, right? This is a case study. So here's an example of how one initiative can bring all of this stuff together. So the intersection at 140th and 32nd Avenue Northeast is particularly unsafe. There's a giant pothole right in the middle of the intersection. A school bus stops here twice a day. It's very close to Little Brook Park, but it's also close to 2 towing companies, so there's big tow trucks that are constantly driving down the street. There's a memorial to a community member who died at this intersection. All of this stuff is a sign of the limited public and private investment in the area. The reality and the reputation of this intersection probably prevents people from traversing the area by foot or by bike. And the limited pedestrian and bicyclist presence, the lack of eyes on the street, as we say, can affect crime. Additionally, if people aren't out enjoying the neighborhood, they're not going to meet each other, they're not going to build social capital, social cohesion with each other. So we have redesigned this intersection. It's really not all that different, except that there's a traffic circle, which is just one idea to slow down traffic here. But the very act of organizing the neighborhood to solve this problem, the problem of this intersection, would be worthwhile in and of itself. Beyond improving safety, the sheer effort of coming together to advocate for engineering improvements would help to develop leadership in the community, get people working together, direct effects on social cohesion. A traffic circle could be decorated by residents, increasing community pride. As a result of these improvements, we expect that people would want to bike and walk more. We heard that a lot, that people do want to bike and walk more. And this could affect both physical health in the neighborhood, as well as crime, because again, having more people on the streets, more eyes on the streets, would result in less crime, less criminal activity. Here's a beautiful word map of some of our qualitative data. So Little Brook has many assets. Residents come from all over the world and they bring to the table a variety of skills and experiences. And consistent throughout our conversations, we sensed and heard a deep yearning to connect with neighbors. At the same time, we heard a hesitancy on the part of many people to accept that the state of affairs that residents of Little Brook abide by every day is something that can, and in our view, should be changed. There are more opportunities now to influence decision-making to serve the needs of Little Brook than perhaps ever before. And we have no doubt that given the tenacity, kindness, and openness of those that we met as we worked in Little Brook, that a brighter future is in store. So we've loved every minute of this project, and we're very grateful to Seattle Neighborhood Greenways and to Lake City Greenways for the opportunity. We also want to thank the Squeaky Wheelers for their generosity in introducing us to the neighborhood. And then thanks to the 140-odd residents that agreed to talk to us. And that's it for us. Thank you. So we have a little time for questions. Yes.
So I've been involved with a lot of the community concerns. One of the first ones that I heard was from the Fire Station 39 discussion. And it seemed like a lot of the tension really, there was some economic tension as well in the community with a perception that there's a lot of low-income housing in the community. Was that part of your evaluation as well?
Well, so that's definitely something that we've heard, especially, and I don't want to be additionally divisive here, but people that live in one part of the neighborhood tend to reside in single-family homes, and then people in another part of the neighborhood live in sort of denser surroundings. And so from the single-family home folks, we did hear a lot of that same sentiment echoed, that people are different, And, you know,
We went and did community events at Jackson Park House, which is a public housing that's run by the Public Housing Authority. And one concern they had is that they've had events in the past in public housing, but people outside of the housing frequently don't come into those events. So we do recommend doing more community events in shared common spaces, such as Little Brook Park, to really entice people to come together regardless of where they might live currently.
I was surprised to see that there's no mention of schools. Is there not a single school in the Little Brook community?
I can do that. So actually, I believe, and Janine can certainly comment on this, that Olympic Hills Elementary is probably the closest school. And so they're actually already working with Greenways because they have a safe route to school that's planned. And I don't remember the exact, is that starting on 30th and going west from there?
It starts at the school it's on 130th, and it goes from 25th, where the school is, to 28th, and it would tie together access to the library, the neighborhood service center, the elementary school. It would be a nice way of connecting all that.
But there are no preschools either.
There's a couple that are in the neighborhood, and that would certainly be an asset to tap into. There's one along 30th that's a Montessori school, but we didn't get to go there. I don't know if residents are using that school, but that's a great idea because there are so many young children who live in the neighborhood, and that seems like a good way to connect them.
I just want to say it's not only, there are young children there, but there's also a lot of social cohesion to a school. Parents come together and talk to each other in a way. It has similarities to a church, and I was also surprised not to see anything about churches. Are there no churches either? Or?
so, well, Little Brook itself is
It's very
quite small.
I know.
Yeah.
6 blocks or so.
Yeah.
We did hear a lot about people going to churches downtown, going to churches in Lake City to some extent.
Okay.
But again, they're not located in the core of Lake City.
Yeah, for instance, for folks who are Ethiopian, we heard that a lot of them went to churches either downtown or in South Seattle. So they were, wanted to be connected to that specific area. And I believe there was an Eritrean church that was located maybe in Greenwood.
There's one on 15th
Yeah.
and 125th,
Yeah.
so it's actually quite close.
And we have analyzed case studies for organizations like Safe Routes to School that purposefully tries to walk students together, through streets, and that would be a partnership with Lake City Greenways to really develop that route for students to take. Because even interviewing students, we noticed that youth came from Nathan Hill as well as from X-Time.
There are schools close enough that Little Brook Park actually qualifies for the summer sack lunch. My understanding is that summer sack lunch has to be held within a certain, I don't know, perimeter from a school. So there's schools in close enough to Little Brook Park that it would qualify for that. And that includes some schools that are in shoreline. At least that's what Randy told me from Parks. And there is also a youth touring program that's part of the Jackson Park Village, which is part of that same complex with the Jackson Park House.
Yeah, and that seems to be a real asset of the community and a way that parents connect kind of in the way that you were describing. So yeah, that's definitely a neighborhood asset that we identified and definitely recommend that folks use to connect.
Did you run across cultural differences in the way that people perceived and kind of used their neighborhood?
Can you be more specific
Well,
about that?
you did speak to different people of different cultures and language groups, and was there a difference in the perception of safety and the amount of time they, went outside, what they did with their children?
One example comes to mind in terms of sort of, interaction with the police, and I think that's kind of it. We've recommended that people connect with the police to try to do some of the crime prevention, but I think should definitely be aware that there are different interpretations of what that means. So I spoke to one woman in particular who said that she didn't like seeing more of a police presence because she felt like that meant that there was more bad stuff going on. You know, whereas a lot of people would say, oh, I want more of a police presence because then it's a prevention thing. So that's one example that I can think of. And we also did hear from people who said that they didn't use the park, that they would take their kids and get in their car and drive far away. So I don't know if you all have other examples, or if, yeah.
I mean, for the qualitative analysis, we didn't really, I don't believe we stratified by cultural group. We can only speak of individual experiences that we had while interviewing with each person, and we can't really lump that into their cultural, their ethnic group. However, I mean, there was a wide range. Some mentioned that they loved the neighborhood. They felt like it was safe. They liked being so close to the water. While other groups recognized that, no, I like, I feel kind of dangerous. I go outside of the park to do activities with my kids, things like that. So there was a wide range.
Other people have comments from our group?
This isn't exactly cultural, but we talked to a number of people who were from other countries who actively compared the safety to where they had come from. And so there was a guy we talked to from Taiwan who was like, oh, the traffic here isn't a problem at all. Like, are you serious? So there might be some kind of conversation that would have to go on to, compare this to other places in Seattle or something like that just to generate awareness.
And others couldn't really comment on crime and prevention because they just said, oh, I'm working all day. So I just leave my apartment, go to work, and come back. So, but they haven't experienced anything, any negative experiences in the evening.
Ash?
I think more so than cultural groups, we had this sort of geographic difference of opinion as we went along. So there's parts where there's single-family homes, as Patricia mentioned, and they're sort of seen as the upper part of the valley, and then there's sort of, you go down the valley, and like there's more apartments, and there's more lower-income folks, and so the opinions that you hear as you pass through this really tiny 10-block radius just changes. And it's not cultural, it's more geographic than anything.
Well, I want to thank you for a particular kind of cultural humility that I noticed, and that is the culture of academia and then the culture of actual folks in the neighborhood. I'm here as a citizen, and for example, I want to say the fear and comfort map was instantly readable to me, and that's such a beautiful use of research methods and tools to make it more understandable, as you said, recognizing themselves. Somebody said they weren't recognizing themselves, but I feel through your work people recognize themselves. Then my question is there some kind of follow-up either that you get to have or the next team from public health does so the community is stirred and then they can go forward with it, with your help?
Well, I mean, maybe we should turn it over to Janine to speak about that.
I'll just say a couple things. What we got out of this report, the 60-page report that they did, is the most amazing chunk of information that we could have gotten for. It was way more than we expected, and we have many tools at our disposal now. But so Lake City Greenways and the squeaky wheels and the incipient leadership that we're going to find in Little Brook is going to get its act together and get some things done. But I wanted to mention that on Thursday the students did a presentation in Lake City. We had a really great turnout of not just Little Brook residents, but many residents from around Lake City who want to know more about the neighborhood. And it just happened that a couple who live in Little Brook, whom none of us had encountered before, emerged as people who really want to do some stuff, and they live on 140th. And it happens that Seattle's SDOT's traffic calming school happens this week, and it's a prerequisite to getting traffic calming devices in your neighborhood. So they and I are going to go learn about traffic calming, and the first thing we want to start is working on the project that these students identified and see what we can get done there. And we know from experience that if we can get a footprint down of something positive and have people see that things can change, that it's only going to get better from there. So this has been a real gift to the Little Brook community and to Lake City Greenways.
And I think one thing that makes our community project different from others is that we really utilize a continuity of research and also, just the people we work with, we want to continue and provide that information to them. So every step of the way, we always consulted with key leaders of the community, whether the questions were working, and then we also made sure that the presentation was palatable before we presented. And then we actually went into the community and gave a community presentation. And from here, Lake City Greenways is actually putting our report and making that available to anyone who wants to see it. So I think that in itself really continues our work with the community.
We have more time for questions and discussion afterwards, but I think we'll turn it over to our colleagues. We're just going to quickly switch media. I don't think so. It should be pretty smooth.
Maybe while you're doing that, let me, I made some errors. I forgot to recognize my faculty mate, Chuck Thompson. And, of all people forget, I work with one group, Jack works with the other group. And I want to also recognize Deb Sauls from Bike Works in the Rainier Valley, who was our key contact down there as well. So a couple more people recognize.
Peter, is there a way that we could dim the lights a little bit? I think some of the slides are easier because our color scheme is a little bit light. So if we could dim some of the lights up. Oh, look at that.
It's fine.
It's fine.
Is it fine?
Yeah.
Okay. Because we can see them beautifully up on this fancy screen. I don't have lights.
That's good.
Okay. All right. Do you want to move the table? So the clicker isn't working. So we have to advance advancing slides. There's plenty of time. All right. Okay. So good evening, everybody. My name is Jennifer Martin, and this is Liz Verpy, and you've already met Jenya. And we were in the other group of 8 folks, and we worked on a project called Crossing Rainier Avenue, 2 studies exploring the pedestrian experience in the Rainier Valley. So we're going to talk to you about a lot of stuff tonight, pretty much everything that's on this slide. And so in late January, we were approached by Seattle Neighborhood Greenways, the Rainier Valley group, because they had been hearing from private citizens and folks in the business community that Rainier Avenue presents a lot of barriers for pedestrians. And if you've ever walked or biked or driven down Rainier Avenue, you know that it is a major arterial and freight route. It's an active business corridor, meaning that there are businesses lining the streets the entire way. It also separates really densely populated neighborhoods. So if the people who live in the neighborhoods on either side of the street want to get around Seattle at all, they're going to have to cross Rainier Avenue. And lastly, it is also a highly utilized transit route. And the number 7 bus, which is the most frequently used bus in the city, runs along this street. But why would Seattle Neighborhood Greenways approach public health students? What is the connection here? So public health is a broad field, and in it we try to holistically determine health barriers in communities. We must consider all aspects of a person's life, right? So how they access healthy food, how they get to health services that they need, and how they access their social supports. And in 2012, the Surgeon General, Regina Benjamin, announced the nation's first National Prevention Council Action Plan that specifically addresses transit and encourages communities to provide healthy transit options for their residents. And Ed Christopher, who's from the Federal Highway Administration Resource Center, said, quote, "Over the last 10 years, people in the transportation sector have become more aware of the connection between health and transportation, including physical activity, air quality, equity, and access, but that collaboration is still in its early stages," end quote. So as you can see, we in public health are not the only ones who are looking at this connection. But why is this important to public health? So without a number of different means of transportation, individuals are much less likely to walk, bike, or engage in other active modes of transportation. And that can lead to negative health consequences. Consequences that affect physical activity, injury prevention, air quality, and mental health. But what does pedestrian safety look like? So Rainier Avenue, the way that it's structured, has a huge impact on the individuals who visit the Rainier Valley and also for those people who live there. So street design and traffic planning, or the way that things are set up, how close a crosswalk is to you, how big the crosswalk is, and how long you have to wait to cross the street, are all things that affect the pedestrian experience. And overwhelmingly, evidence says that if pedestrians have to wait for more than 30 seconds to cross the street, they're more likely to jaywalk. And increases in jaywalking mean decreases in pedestrian safety. So in Seattle, in 2011, in King County, there were, pedestrian fatalities accounted for 21% of all traffic fatalities. And between 2006 and 2010, there were 101 pedestrian fatalities and 625 pedestrian injuries in the city. And this is important to public health, not only because of injury and prevention, but also because if people don't feel safe walking, they're not going to, and that's going to have really negative health impacts. So what's happening in the Rainier Valley? Well, Rainier Valley Greenways had a theory that they wanted us to test. They thought that high-income neighborhoods, unlike those in the Rainier Valley, would have signal timing that favors pedestrians instead of vehicles. And specifically, they were interested in having us look at Columbia City and Rainier Beach, which are two neighborhoods in the Rainier Valley that are kind of separated from each other. But in order to look at this, we also had to have a comparison group, or a comparison neighborhood, rather. And so after talking to our partners and after talking to folks from the Seattle Department of Transportation, we decided to use Ballard as our comparison neighborhood. And we did that partially because Market is similar to Rainier Avenue and that it's also a freight corridor. The traffic volumes are similar, and there are a lot of pedestrians that have to cross both of the streets. But what do these neighborhoods actually look like when they're compared? So this table looks at some of the demographics between all three neighborhoods. And as you can see, Columbia City and Rainier Beach both have more residents than Ballard. They have sort of an older population, and they have a more culturally and ethnically diverse population. But what's most important for our question is this last bar. This last bar that tells us that in general, Ballard residents make over $20,000 more than residents that live in Columbia City and Rainier Beach. So for us, that was pretty important. But one thing that was also important was that although Columbia City and Rainier Beach demographically look really similar, when we were there, we realized that they're two really distinct neighborhoods. So what does safety look like? This is one of the places where it's really different in the two neighborhoods. So in one of the neighborhoods, safety really meant personal safety, how you feel when you're walking down the street. In the other neighborhood, safety was more focused on traffic stuff. And we'll talk a little bit about that later. So all of this stuff led us to our research question, which became, what are the barriers associated with pedestrians crossing Rainier Avenue in Columbia City and Rainier Beach? And in order to fully answer this question, we came up with two sub-questions. The first of which is, what is signal timing in Columbia City, Rainier Beach, and Ballard? And is there a statistically significant difference among the neighborhoods? And the second sub-question is, what do people in the Rainier Valley perceive as barriers to crossing the street? And now Liz is going to talk a little bit about how we designed their studies.
Great. So first, I'm going to go through our first study on signal timing, describe the methods and results, and then I'll touch on our second study regarding surveys, their methods and results. So for signal timing, to begin, we had a few meetings with the Seattle Department of Transportation. We also consulted with some traffic experts, engineering experts. And then when we were in the field, we conducted 21.5 hours observing signal timing, observing people walking across the street, waiting for the lights to change. It was really fun. It looked a little strange. And in doing that, we also counted jaywalkers. And then once we had collected all the data, we entered it into SPSS and analyzed it from there. So as you can see from here, in Columbia City and Rainier Beach, we picked picked 2 intersections along Rainier Avenue South to observe for signal timing. And in Ballard, we observed 2 intersections along Northwest Market Street to observe. Now, signal timing, what does that actually mean? We operationalize signal timing into 2 different, basically, chunks. And the first chunk we call pedestrian delay, which is essentially how long does a person wait at a corner until the walk signal lets them cross the street. And the second piece is total crossing time, which we as a class defined as the combination of how long the white walk signal is on, as well as how long the flashing don't walk signal is lit. So on to results. So when we're looking at the pedestrian delay, the average pedestrian delay by neighborhood looks pretty similar. As you can see, these bars all hover around the 50-second mark. So on average, these neighborhood intersections, folks were waiting about 50 seconds. We determined that this is not statistically significantly different between neighborhoods. And in layman's terms, and for folks that don't use SPSS all the time, when I say something is not statistically significantly different, that means maybe we don't really need to pay attention to it. But the flip side is if it is statistically significantly different, it's probably something we want to look at. So again, not statistically significantly different. And we did find that nearly 75% of all pedestrian delays across the study neighborhoods were more than 30 seconds. And this is really noteworthy because, as Jen had mentioned, folks are a lot more likely to jaywalk if they're standing around for longer than 30 seconds. And we want to bring you all into this experience. So I am going to have you all, in your minds, pretend that you are late to a business meeting or a job interview. And you are running up to an intersection, you have to cross the street, get into the coffee shop, you press the pedestrian button, and you are waiting there in silence, starting now. Okay, and walk, right? So it wasn't that bad, but it's kind of a pain, right? This 30 seconds, as you can remember, those bars were hovering around the 50-second walk, so this would actually be even more ideal than what we observed. And in some places, we observed pedestrians waiting up to 96 seconds, so over a minute and a half. Now looking at the total crossing time by neighborhood, as you can see, so the red bars and the top bars for each neighborhood are the mean or the average total crossing time. And we saw that Ballard folks had the longest crossing time. However, this doesn't take into consideration the length of the intersection. So I'm going to talk next about feet per second. And I'm going to liken this to miles per hour. So obviously, if you're driving 25 miles per hour, that's slower than 40 miles per hour. Same with feet per second. If you are allowed something like 2 feet per second to cross, you can cross at a more leisurely pace than if you're allowed something like 4 feet per second to cross an intersection. So the federal standard is 3.5 feet per second to cross a street, and that's denoted by that red line going all the way across. And in our discussions with SDOT, we learned that Washington State adopted the 3.5 feet per second standard in 2011. However, not all intersections had been updated. And through our data collection, we see that in Columbia City, the Alaska and Rainier intersection, per our observations, is at 3.9 feet per second, meaning somebody has to walk a lot faster to get across the street safely. And in Rainier Beach at 50% of Rainier, it's around the federal standard. So if you can imagine, if we collapsed, when we collapsed our data by neighborhoods, we did find a statistically significant difference between the neighborhoods regarding the mean total crossing time. And in a nutshell, that means that folks in Ballard could walk at a slower pace across the intersection in order to arrive on time before the don't walk sign came up. So sort of bringing it back to our research question, our sub-question of, is there a statistically significant difference in signal timing between these three neighborhoods? So are these things we should pay attention to? Regarding pedestrian delay, no. However, regarding total crossing time by neighborhood, yes, as I just said, folks in Ballard were able to cross at a slower pace. All right, and so on to our second study where we used surveys to try and assess pedestrian barriers to crossing Rainier. The way that we went about this was first we reviewed some case studies, then we went out into Columbia City and Rainier Beach at different times of the day and approached folks. We got a 63% rate of success in interviewing 101 pedestrians total. In addition, we had 12 key informant interviews with business owners, community leaders, and other folks whom our community partners helped put us in touch with. And then we analyzed all this quantitative and qualitative data in software, in SPSS and some coding software. The survey respondent demographics, as you can see, our most common age group were folks in their 20s, and our least common age group of respondents were people over 70. We had a pretty equal 50-50 gender ratio of respondents. 7% of our respondents had visible mobility assistance, whether that was a walking cane or a walker. And around 30-ish% of folks we talked to lived in Rainier Beach, and 30-ish% lived in Columbia City. So pretty good representation of those people. The first question in our survey asked, what is your main mode of transportation in this neighborhood? And as you can see, the top two modes are flipped for respondents in Columbia City and Rainier Beach. In Columbia City it was walking first, second transit, and the reverse in Rainier Beach, transit first, walking second. That was statistically significantly different. Our next question was on a scale of 1 to 5, with 1 being very unsafe and 5 being safe. How safe do you feel when you cross Rainier Avenue in general? This was also statistically significantly different, with folks answering in Columbia City feeling significantly safer than those respondents in Rainier Beach. And in Columbia City it was 3.7 rating and 3.2 in Rainier Beach. But when a lot of people came to give us a number on that scale, they often added in, well, my rating depends on some things, such as where they're trying to cross Rainier. It's different, as many of you know, where you're trying to cross. How familiar they were with the neighborhood, and this is sort of a nod to feelings of personal safety. Same with time of day. This question, what factors make you feel unsafe when crossing Rainier Avenue, really gets to our main research question, which, what are pedestrian barriers to crossing Rainier Avenue? And I divided this by the top 3 factors that folks said per neighborhood, and I don't expect you to interpret these visuals. All I want you right now is to notice that there are some differences, okay? So, the statistically significant differences are the fact that in Rainier Beach, 40% of respondents said speeding cars, or car speed, was the #1 factor that made them feel unsafe. And in Columbia City, that was only 21%. Still pretty noteworthy, right? And another thing is that in Rainier Beach, personal safety came up as sharing the #2 spot for reasons why people feel unsafe crossing Rainier Avenue, and that didn't even come close to being in the top 3 spots for Columbia City respondents. And we thought that that was something that really showed the difference between pedestrian feelings in those neighborhoods. Other factors people mentioned were things like drivers disrespecting traffic lights, blowing through red lights. A number of folks noted cars turning onto Rainier from side streets and going through the crosswalk when the pedestrians had the light to walk. That was something a number of people said. A lot of people also noted drivers texting, being distracted. I think one or a couple folks even said that sometimes when they were walking, a car would speed up when they saw a pedestrian. Another question was, as a pedestrian in this neighborhood, do you have enough time to cross Rainier Avenue? So 59% of our survey respondents said yes. That's the majority. Okay, great. 100% should be saying yes to this. We thought that was pretty telling. And even though the majority of folks did say yes, a number of people did say, okay, well, I can cross, but I'm worried about the elderly folks I see crossing the street, parents with young kids, folks that aren't as able, sort of reflected in this quote up there. We have a lot of personal stories and narratives that we've collected, which are highlighted more thoroughly in the report, but I wanted to bring this one up. Right now, this is from a pedestrian in Columbia City, sort of highlighting her or his feelings of unsafety, I suppose, when a car is turning onto Rainier Avenue. And they say, one day when I was crossing right here, I almost got hit. A guy almost ran me over. I was in the crosswalk and I had the light, but this guy turning was going too fast, and I had to jump back on the curb or he would have hit me. And now over to Jenny to discuss some conclusions and recommendations.
Thanks. I just want to make sure everyone knows that we actually have a one-page flyer. Sierra, we want to wave a little bit. Sierra has copies of our one-page flyer that details all of our recommendations and other information in full if you want to learn more. So let's talk about the built environment. This is a picture of a model for something called complete streets. And complete streets are those that maximize movement for people in all modes of transportation, including people on foot, people on bikes, people in cars, and people on transit. I think a lot of people in the room would agree that this is an ideal, but we have a long way to go before we get there along Rainier Avenue. There's a lot we need to change. And this, like I said, ideal. Signal timing is absolutely an important part of what we found in terms of pedestrian safety, but it is not the only thing that we're concerned about, and we want it to be part of a larger conversation. We also, though we did find that people in Ballard had more time to cross the street than people in Columbia City and Rainier Beach, we are not prepared to say that we proved the hypothesis because I don't think we collected enough data to really prove it. So that is definitely something that deserves more exploration. So the strengths, I'm going to talk a little bit about the strengths and limitations of our project in our report. We did collect data throughout the day on different days of the week. We had large sample sizes for both signal timing and our pedestrian surveys, and the selection of a comparison neighborhood did help us out in terms of gauging our results against another neighborhood. Our limitations, we did not collect surveys from non-English speakers. Because we were approaching people who were walking on Rainier Avenue in Columbia City and Rainier Beach, we probably oversampled walkers and underrepresented or undersampled drivers. We didn't reach as many pedestrians with mobility limitations. We did not record any of the conversations we had. We were taking notes while we spoke to people, which means that we don't have direct quotes. We have our notes from what people were saying. The Ballard intersections we chose did not have pedestrian initiation, which means they didn't have a push button, which does make them a little bit different than some of the intersections we chose in Columbia City and Ballard. We did have some time and resource constraints. And again, at 22nd and Market, it's a 5-way sort of weird intersection, as opposed to the other ones we looked at, which were all 4-way. And one of the days we sampled was the Ballard Market. So again, we probably oversampled pedestrians at that intersection particularly. So now I'm going to talk a little bit about the recommendations, and I'm going to talk about a few of them. We divided them into short-term, long-term, short-term, medium-term, and long-term, or green, yellow, and red. They're fully detailed in our report, so I'm just going to highlight a few from each of these. So as far as short-term recommendations, the first two we want to highlight are increasing the signage of the speed limit along Rainier Avenue and implementing no turn on red policies, both onto and off of Rainier, because so many of the pedestrians we spoke to had concerns about cars not paying attention when they were turning. Other ones include decreasing the feet per second, so changing the signal timing, and engaging the community in a sort of larger conversation about what they want. As for medium-term recommendations, and we separated these by feasibility and cost, so these ones are a little bit more expensive and a little bit sort of take a little bit more to implement. So first of all, photo enforcement of red lights. A number of our pedestrians that we spoke to actually suggested this because they feel like people run red lights because they know that nobody's going to stop them. So if we implemented some photo enforcement, putting flashing lights above crosswalks as cars are approaching, especially in Rainier Beach, a lot of the crosswalks are pretty far apart, so cars aren't always looking for them and looking for pedestrians. And then we also talked a little bit about increasing the police presence, especially in Rainier Beach, which some of our key informants and pedestrians spoke about. One person actually said it would make them feel less safe. And we want to be really careful about that because increasing a police presence in a neighborhood that is low income and has a high proportion of people of color, we want to be really sensitive and careful about that. So we think that that's a community conversation, but it is something that people recommended to us, so we did include it. And then as for long-term recommendations, in the top left corner, what you see here is called a scramble. And what that means is that traffic is stopped in all 4 directions, so pedestrians are free to cross in any direction, including diagonally across the intersection. Now, this does slow down traffic flow. It is expensive to implement, but how cool is it? And how much safer would you feel if you knew that there were no turning cars and nobody was going to, be cutting you off? So it's a great ideal, but we recognize that it would be probably pretty hard to implement. The last thing I want to highlight down here in the bottom is the idea of a sort of small business corridor revitalization, especially in Rainier Beach. There is that great section of Columbia City where you've got small businesses on both sides of the street, outdoor dining. Rainier Beach has nothing like that. And one of the things that we really want to do is encourage walkability by revitalizing and beautifying some of these neighborhoods and making it attractive to walk outside, which also, as the other group said, puts more eyes on the street and deters crime and increases the amount of people walking. So just by way of conclusion, Rainier Valley, Rainier Beach and Columbia City are very different and really unique communities, but both have a lot going for them. And we want to make sure that we follow through with a real community engagement process and talking to people there about what they want and sort of mobilizing the community structures that already exist, much like the Little Brook group was talking about. So this is just an example of a sort of community beautification project and a chess program that was started by a police officer in Rainier Valley. And sort of taking some of these ideas and engaging people in a much broader conversation about community safety, community walkability, community livability, and not just about pedestrian safety. We think that this is part of a much bigger conversation, and we're really excited to see where Greenways goes with this. So we want to take a minute and thank all the people that helped us out with this project, our devoted community partners, our key informants, our friends at SDOT and Portland State who helped us with some of the signal timing stuff, our faculty help from the University of Washington, and of course the Columbia City and Rainier Beach communities. So if anyone has any questions, I like this because this is an intersection in Sacramento, California that went from what you see on the left to what you see on the right with the help of the Walkable and Livable Communities Institute. So if you look up Dan Burden online, you can find a lot of his work. He has a lot of these, and I think they're great. So if anyone has any questions, we'd be happy to take them.
I want to make sure you're talking to me.
Yeah, absolutely.
Okay. First off, they have a scramble up on Beacon Hill.
Cool.
And so I am curious as to know if there was a difference, okay, when people said, when you asked the question, do you feel safe crossing the street, is there a difference between Columbia City and Rainier Beach?
Okay. Liz, do you want to talk about that?
Difference between what they rated it or what factors?
Well, you said 59%.
Yeah.
So what was there, and I'm assuming that's just all of Rainier Valley, both numbers combined?
So it was 59% of people said they had enough time to cross the street.
Okay, so was there a difference between Columbia City and Rainier Beach?
In timing or in safety?
In the perception of safety?
Yeah, I can,
So there definitely was, and it was actually, we broke it down, so we got surveys from people in the 2 neighborhoods, And then we also went through and said, okay, but who actually lives in those neighborhoods, and looked at that. And the difference got even bigger when we stratified it down to just residents who live there. And I think, do you have that?
Are we talking about the, sorry, I think that you guys are talking about different things. Are we talking about the safety, who felt like the safety rating of 0 to 5 when crossing the street, or the actual, did you have enough time to cross?
Did you have, what was the 59%?
That was sure have enough time to cross.
Okay,
Yeah.
so what was the difference between Rainier Beach and Columbia City?
So 57% of the folks surveyed in Columbia City said they had enough time, and 56 in Rainier.
Okay, so there wasn't
So it
that.
wasn't statistically significant.
Okay,
The big difference came in their perceptions of safety.
yeah.
Were you gonna say something?
No, I'll just.
Yes. I didn't understand this Rainier Beach thing where you had the crime scene tape graphic as, it was about personal safety, I think was the phrase, and that didn't come into play in Columbia City. But I don't understand all that personal safety encompasses crossing Rainier Avenue within that category. Is it, I don't ever want to walk across Rainier because bad things happen on Rainier? Or what are the threats?
So I'm sorry, Reed. So when we coded for that, and I say we, there was a team of us doing the qualitative coding, that included things like muggings, stray bullets, and a lot of illegal activity, especially drugs. So personal safety, we designed to include mostly those 4 factors. And we did, we had a 17-year-old young woman in Rainier Beach saying, I saw someone get shot at that intersection, so I'm nervous.
So it's not actually crossing the street.
Right.
It's the
It's the
atmosphere
neighborhood.
around them.
Right.
Okay. Okay.
But the question was framed,
Uh-huh.
and what factors make you feel unsafe when crossing Rainier Avenue? So it's interesting that
So
some
what are you
folks.
thinking?
Yeah,
Yeah.
and I think the difference between the two communities there is really telling, right? And we know that there are certain intersections we looked at that have high incidences of crime. So the fact that we were asking people on that intersection, how safe do you feel crossing the street if they saw someone shot there a month ago, whether you're crossing the street or standing there, it creates an atmosphere of unsafety, yeah.
I had a question about the pedestrian scramble. What is the pedestrian delay, typical delay on a scramble? And do you find more jaywalking, less jaywalking, or are people happy to wait when they know that they get to go?
I don't know if we have a solid answer to that. I would assume, frankly, that, well, what we found I would think that it's entirely possible that you would wait longer at a scramble because because part of the idea is you still want to try to make sure that you're not holding traffic up too much, and because you're stopping all of the traffic. But SDOT may have an answer to that.
Yeah, so with an all walk day, everybody can go, and then all the vehicles do. So your cycle length, the time we wait for the full cycle to come back is actually longer. So if you come at the very end of the scramble day, you're waiting a lot longer. You do see a lot of people who are walking with the traffic, and so you get a lot of them drivers in here.
Yeah.
But you see scrambles more in higher density pedestrian areas. It seems like Pike Place Market's a good example. I mean, I would be surprised going down Rainier to see, in Rainier Beach particularly, a scramble at this point, just because of there's not that yet, that kind of pedestrian density. And not to say that it wouldn't encourage a pedestrian density, but usually it seems like the density comes first and then
Absolutely.
the scramble.
Yeah, I think that density also promotes things like eyes on the street. But one of the things that we talk about a little bit in the report is also this question of gentrification, and a lot of this walkability and neighborhood safety and eyes on the street come with gentrification and privilege, and we also want to make sure that we're keeping an eye on that. But I think that at some of the intersections we looked at, especially Henderson and Rainier, there are a lot of bus stops around there, so you get a lot of people jaywalking to catch a bus. So if you did have something like a scramble, it would mean that the buses couldn't go, and you could run over to catch your bus.
So I did appreciate the fact that you mentioned that some intersections didn't have push buttons that came up automatically. Like vehicles don't have to push a button to get the green light.
Right.
But I'm wondering if you looked at the pedestrian signals themselves and whether, countdown timers are located at some location and that makes a certain intersection feel more comfortable and safer. They knew how much time they had to cross.
So interesting things about where the push buttons are located. In Columbia City, especially on Edmonds, which is one of the intersections we time, the buttons aren't in the same place to cross the different ways of the street. So people will hit the wrong one and then they'll wait and look around and then they'll realize the right one is a few feet away. And the countdown comes really quickly at Edmonds. So you have very little time to start and then all of a sudden you have a countdown. It's only a 4-lane intersection right there and it's a pretty short crossing time. But one of the things that came up a lot for us is there's a school for the blind in Columbia City. And so we had some interviews with folks who do have visual impairments who would say, I can't find the button. I can't find the button when I'm at the intersection and that's a big problem for me, or I can't hear it because it's not actually the button. The signal that is beeping is not actually the one that refers to where they're supposed to be walking. And we actually watched two visually impaired folks jaywalk because they could hear the other side of the street's beeper. And no cars went and no cars honked at them. And when they got to our side of the street, we interviewed them and they said, well, these timers, they just seem to be a lot louder. And I was thinking, that wasn't, you had a red. Like you couldn't hear it because you had a red. And so it was very interesting for us to have that experience with them.
So we did look at that.
That's interesting because I don't know if this is true in other places. It just happens to be the only place I've ever seen it or heard it is in Eugene, Oregon. They have speaking signals that across a very dangerous arterial called Franklin Boulevard that I think is a lot like Rainier and Aurora and Lake City Way. And it says walk across Franklin Boulevard on Pearl and what direction. And it says it over and over again and is also counting down. So it's pretty much the perfect thing for someone who's sight impaired. I don't know how prevalent those are. Maybe it's just a Eugene thing.
Maybe. But we can write it down and bring it to.
I have a question for both groups. Both did a great job. I want to back out from specifics of transportation and streetscapes to ask a bigger question. What did you learn about sense of place, sense of identity with the community, social capital that grows in communities?
I'd like to open this up to a lot of the rest of our classmates too. It's a great question. So anyone would like to contribute?
I will say, Sierra and I visited the last Columbia City Greenways meeting to present what we were going to be doing. And the amount of information that the folks who were at that meeting knew about their neighborhood totally blew my mind. Like when they were talking about other resources that they have in their community or how their community functions or when a new school was going to be coming or when that last school had closed, just all of the information that was in that room about their neighborhood was really impressive. And so the social cohesion there in that room about how much they cared, I thought was pretty impressive. I didn't get to go to the Rainier Beach meeting, and maybe Deb could talk about that, but I thought it was quite impressive.
Yeah, and I mean, even the 17-year-old girl who saw someone shot at an intersection said to me, like, I've lived here for 3 years now, so I know a lot more people and I feel a lot more comfortable, which I think speaks to a connectedness, if not a larger issue.
I think that's an interesting complexity. I mean, I think that we talked to a number of people in Little Brook. Most of the people, when we asked them how do you like living here, said, fine, it's good. And then the longer you talk to them, they'd be like, oh yeah, I almost got hit on that corner 2 weeks ago, and no, I don't trust any of my neighbors, I don't really trust them, they're shady characters. And, it's really nuanced, and people's, thought of what their thought about their community is different than maybe their feelings about the community, and so that's really fascinating.
I would like to add, does anyone have a theory as to why that is? Little Brook's a it has little social capital. Does anyone have go ahead.
Well,
oh no, Kelly can't answer.
Okay. Well, in that book, my sense was that, I think it's a fairly transient community to some extent. There's a large turnover of people, especially in the apartment complexes. And then within, there's some cohesiveness between the cultural groups, but other than that, everybody sort of just keeps to themselves. And there's no space to interact either, and there's no, people are sort of afraid. Like, a number of people that I talk to, they're like, well, like, the only way I get information about my neighborhood is through the SPD website. Like, and so if they're looking at Seattle PD to look at crime rates in their neighborhood to get information, that says a lot about cohesion between people.
I'll give you my insight onto both of these. These two communities, Columbia City and Rainier Beach, are very old. They've had people trying to build community there over the years. In Little Brook, it's a very new dumping ground, actually. So there's really been no time for a community to develop. I think within the last 10 years, that population is turned over. When we found one couple that lived there forever, we were shocked. That just doesn't happen in Little Brook. So there's a big difference going on between those two communities.
Actually, I was going to give you that answer or something very similar, because what Randy and I found was that we would develop leaderships with certain groups of people, and then they would move out of the community. So it's a very transient community. And you know, I've worked in Columbia City and Rainier Beach, and you know, when my experience with them was that there was a renaissance in Columbia City in the early 2000s that really changed the way Columbia City felt and looked like. In the early 2000s, there was a lot of crime in Columbia City. And it qualified for a weed and seed site, which just basically took, you know, everything down to Rainier Beach. And then eventually, and for people who don't know what weed and seed is, it's a crime prevention and law enforcement program implemented by the federal government. And eventually they excluded Columbia City because it didn't have the same amount of crime and focused on Rainier Beach.
We need to do that in Little Brook.
I think there's, yes, you had a question for that.
Thank you. I'm just interested if there's been some kind of a comparison study that you're aware of, if you're not include this, but a comparison of satisfaction or dissatisfaction between pedestrian-initiated crosswalks and a different type of timing. Do you know? I have my own feelings about that, but I would be very interested. I've had out-of-state visitors say to me, oh, Seattle's so friendly, you can't cross unless you tell the cars you want to cross now.
Yeah.
And so, you know, I'm wondering if, I would be very interested in seeing, you know, some data on that.
Yeah, I think it'd be something interesting to look at. And our report does have some case studies about different kinds of crosswalks, but we also found in our signal timing that a lot of times you could hit the button as many times as you wanted, and it didn't do much because the lights were on a cycle.
You don't just keep hitting the button.
Right, because the lights are just on a cycle and it's going to just come up when it comes up. But some of them, if you push the button, it does actually change the signal faster. So it would be interesting to look at.
I think we have time for one more question and then we're going to have to end.
Okay. Mine is mostly a comment, and it's the comparison between Ballard and Rainier Beach and Columbia City, and that's that I think that the steepness of an intersection does have an effect. I mean, I ride my bike a lot, so it's a little different with walking, of course, but it's something that wasn't in your look at the intersections. And if you think about Alaska, for example, and Rainier, there is quite a climb to that, crossing the intersection. And for someone with children or an elderly person crossing that street, a shorter time to cross the street has an impact versus Ballard, where everything's flat.
Yeah.
And it's something to think about. If you were going in the opposite direction and going downhill, say, it might not make such a difference. It might even speed you up a little bit with those kids pulling them along. But it's certainly something to think about.
That's a really good point because that adds a lot of nuance to the feet per second. Thanks.
Okay, yeah, so I think out of deference to everybody's time, it's 8 o'clock. We should close this, but I'm sure the students will be around for a few minutes cleaning up. If you have more questions or comments. So thank you all for coming. This was a great session.